Here's something most people over 60 have never been told. Right now, roughly 1 in 7 adults in the United States is living with some degree of chronic kidney disease. And here's the part that should really get your attention. Up to 9 out of 10 of them have no idea it's happening, not because they're careless, not because they skip checkups, but because the kidneys are one of the quietest organs in the entire body. They can lose 30, even 40% of their function and still keep working well enough that a standard checkup, a normal feeling day, and even a routine blood pressure reading won't raise any alarms. By the time most people notice something is wrong, the kidneys have often already been struggling for years. That's what I want to talk about today. Not to alarm you, but because I've spent years studying how the body sends warning signals long before a diagnosis ever shows up on paper. And when it comes to the kidneys, those signals are subtle. They hide in things we blame on aging, on a bad night's sleep, on getting older and slowing down. In the next half hour, I'm going to walk you through 5 of these silent signs. Some of them you've probably experienced and dismissed without a second thought. One of them in particular surprises even people who work in medicine because it doesn't show up where you'd expect it to at all. Stick with me to the end because the 5th sign is the one I most wish more of my own patients had recognized sooner. Let's talk for a moment about why this matters and why it develops the way it does. Your kidneys are 2 fist-sized organs sitting just below your rib cage, one on each side of your spine. Most people think of them as simple filters, and in a way they are, but they're doing something far more sophisticated than just making urine. Every single day, your kidneys filter about 150 quarts of blood. They pull out waste products, balance your body's fluid levels, regulate your blood pressure, keep your bones healthy by activating vitamin D, and produce a hormone that tells your bone marrow to make red blood cells. That's a lot of responsibility for 2 organs most of us never think about. Here's the challenge. Kidney tissue doesn't have pain receptors the way your skin or your joints do. When something goes wrong in a kidney, it doesn't hurt. There's no sharp signal telling you to pay attention. Instead, the kidneys quietly compensate. Healthy portions of the kidney pick up the slack for damaged portions. This can go on for years, sometimes decades, before function drops low enough to cause symptoms that are impossible to ignore. This is precisely why kidney decline is often called a silent condition. It's not that the body isn't sending signals, it's that the signals are easy to misread. Fatigue gets blamed on poor sleep. Swollen ankles get blamed on standing too long. Muscle cramps get blamed on dehydration or getting older. Each of these on its own seems harmless, but together, over time, they can point to something worth paying closer attention to. The reason this matters, especially after age 60, is simple biology. Kidney function naturally declines somewhat with age. Blood vessels throughout the body stiffen slightly, and conditions like high blood pressure and type 2 diabetes, both of which are major contributors to kidney strain, become more common in this decade of life. None of this means decline is inevitable. It means awareness matters more, not less. I want to be clear about something before we go further. This video isn't about causing worry. It's about giving you the tools to notice what your body may already be telling you, so that if something needs attention, you and your doctor can catch it while there's still the most room to act. Before we get into the 5 signs, let me tell you a little about why I focus on this the way I do. I'm Dr. William Lee. I've spent close to 2 decades practicing internal medicine, much of that time working closely with patients managing high blood pressure, diabetes, and the kind of everyday health questions that come up more often as we move past our 50s and 60s. Kidney health sits at the intersection of nearly all of that. It's rarely the headline condition. It's almost always the quiet variable in the background, shaped by blood sugar, blood pressure, hydration, medication use, and diet. Everything I'm going to walk you through today is grounded in guidance from organizations like the National Kidney Foundation, the Centers for Disease Control and Prevention, and peer-reviewed research published in journals focused on nephrology and internal medicine. I'm not going to hand you a single fringe theory or an unproven shortcut. My goal is simply to translate what the research and clinical guidelines already tell us into language that's actually useful in daily life, because I've found that most people are never given this information in a way that sticks. With that said, let's talk about how the kidneys actually work, so the rest of this makes complete sense. Think of each kidney as containing roughly 1,000,000 microscopic filtering units called nephrons. Each nephron has a tiny cluster of blood vessels called a glomerulus, which acts like a sieve. Blood flows in, and the sieve holds onto things your body needs, like protein and red blood cells, while letting waste products and excess fluid pass through into what eventually becomes urine. When kidney function starts to decline, one of the earliest changes is that this sieve becomes slightly less selective. Small amounts of protein, which shouldn't normally pass through, begin leaking into the urine. This is called proteinuria, and it's often one of the very first measurable signs of kidney stress, sometimes appearing years before someone would ever feel unwell. At the same time, waste products that the kidneys would normally clear out, things like urea and creatinine, begin to build up more slowly than they should. In small amounts, this causes no noticeable symptoms at all, but as the buildup continues, it starts to interact with other systems in the body. It affects how your bone marrow produces red blood cells. It changes the balance of minerals like potassium, calcium, and phosphorus. It even affects the nervous system and how sharp your thinking feels day to day. This is the key concept I want you to hold on to for the rest of this video. Kidney decline rarely announces itself as a kidney problem. Instead, it shows up as fatigue, as swelling, as changes in sleep, as muscle cramps, as brain fog. The kidneys are so deeply connected to nearly every other system in the body that their earliest warning signs often look like something else entirely. That's exactly why so many people miss them, and that's exactly what we're going to fix over the next several minutes. Sign 1, persistent, unexplained fatigue. Let's start with the sign almost everyone experiences at some point and almost no one connects to kidney health. Fatigue is one of those symptoms we're conditioned to explain away. We tell ourselves we didn't sleep well, we're getting older, we've been under stress, or we simply need more coffee. And most of the time, that's exactly what it is. But there's a specific kind of fatigue worth paying closer attention to. It's the fatigue that doesn't improve with rest, that lingers for weeks rather than days, and that feels more like a heaviness in your body than simple tiredness. Here's why this connects to the kidneys. One of their lesser-known jobs is producing a hormone called erythropoietin, often shortened to EPO. This hormone signals your bone marrow to produce red blood cells, the cells responsible for carrying oxygen throughout your body. When kidney function declines, EPO production drops, and red blood cell production slows down along with it. The result is a condition called anemia, where your blood has fewer oxygen-carrying cells than it should. Anemia doesn't cause dramatic symptoms in its early stages. It causes exactly the kind of fatigue that's easy to dismiss. You feel a little more winded walking up the stairs. You need a nap in the afternoon when you never used to. Everyday tasks feel like they take more effort than they should. Research published in journals focused on kidney disease has consistently shown that anemia related to reduced kidney function often develops gradually and is frequently underrecognized precisely because it mimics ordinary tiredness so closely. The people most at risk for this particular sign are those with long-standing type 2 diabetes, high blood pressure that hasn't been tightly controlled over the years, or a family history of kidney disease. If you fall into any of these categories and you've noticed a kind of fatigue that feels different from your normal baseline, That's worth mentioning to your doctor, not brushing aside. What should you do instead of ignoring it? Pay attention to the pattern, not just the feeling. Ask yourself whether this fatigue has lasted more than a few weeks, whether it's paired with looking unusually pale, or whether it happens even after a full night's sleep. If the answer is yes to any of these, a simple blood test that checks kidney function and red blood cell counts can clarify what's going on in a matter of days. This isn't about panicking over every tired afternoon. It's about recognizing when tiredness has become a pattern worth investigating. Sign 2, changes in urination. You've learned to ignore. This next sign tends to be the most overlooked, mostly because it feels almost too personal or too minor to bring up with a doctor. There are actually two changes worth watching here, and they often show up together. The first is foamy or bubbly urine, particularly if the foam is persistent rather than occasional. The second is needing to urinate significantly more often at night than you used to, a pattern doctors refer to as nocturia. Let's start with the foam. A small amount of foam now and then is completely normal, but persistent, excessive foam, especially foam that looks almost like the head on a glass of beer, can be a sign that protein is leaking into the urine. Remember the filtering sieve we talked about earlier. When that sieve becomes less selective, protein molecules that should stay in the bloodstream start passing through into the urine instead. This is one of the earliest detectable signs of kidney stress, and it's one that a simple urine test can confirm within minutes. The second pattern, needing to urinate more frequently at night, connects to how well the kidneys are managing fluid balance. Healthy kidneys concentrate urine more efficiently overnight, which is why most people can sleep for 6 to 8 hours without needing a bathroom break. When kidney function starts to decline, that concentrating ability weakens, and the body ends up needing to eliminate fluid around the clock rather than saving it up. Many people mistake this for simply drinking too much water before bed or an unrelated bladder issue, when it can actually be an early signal from the kidneys themselves. The people most likely to notice this are those managing diabetes, since elevated blood sugar can directly affect how the kidneys filter and concentrate urine, as well as anyone with a long history of high blood pressure. What should you do instead? Start paying attention the next time you're in the bathroom. Persistent foam that doesn't dissipate quickly, or a new pattern of waking up 2 or 3 times a night to urinate when that wasn't the case a year ago, are both worth mentioning at your next appointment. These are inexpensive, painless tests to run, and they often provide answers faster than almost any other assessment your doctor can order. Now, the next two signs are ones that almost never get connected to kidney health at all, because they show up in places you wouldn't expect, one in your hands and feet, and one in how clearly you're able to think. The final sign in particular is the one that surprises even physicians, because by the time most people notice it, they've usually attributed it to something else entirely. Before we get there, if you're finding this helpful, this channel is built around exactly this kind of practical, evidence-based information for the decades after 50. Subscribing helps more people your age and mine actually find it. There's no pressure, just an invitation if this is useful to you. Now let's keep going. Sign 3, swelling in the ankles, feet, or hands. If you've ever taken off your shoes at the end of the day and noticed a faint sock line pressed into your skin or rings feeling a little tighter than they used to, you've experienced a version of this sign. Most people assume swelling like this comes from standing too long warm weather or simply getting older. Sometimes that's exactly right. But persistent swelling, especially when it shows up in both legs and doesn't fully go down overnight, deserves a closer look. Here's the mechanism. Healthy kidneys carefully balance how much sodium and fluid your body holds onto versus eliminates. When kidney function declines, that balance shifts, and the body starts retaining more fluid than it needs. That excess fluid doesn't stay in the bloodstream. It moves into the surrounding tissue, most noticeably in the lowest points of the body affected by gravity, which is exactly why ankles and feet are usually the first places this shows up. In some cases, it can also appear as puffiness around the eyes, especially in the morning. This kind of fluid retention, known medically as edema, has been well documented in kidney disease research as one of the more visible, though still frequently dismissed, indicators of reduced kidney function. It often develops gradually, which is part of why it's so easy to miss. The swelling one week isn't dramatically different from the week before, so the change never quite registers as a change at all. The people most at risk here are those with existing heart or blood pressure conditions, since kidney function and cardiovascular health are closely intertwined, each one placing added strain on the other when either starts to falter. What should you do instead of assuming it's just tired feet? Try a simple test at home. Press a finger gently into the swollen area for about 5 seconds. If an indentation remains for several seconds afterward, that's a sign worth discussing with your doctor, particularly if the swelling has been present most days for more than a week or two. This single detail, sock lines that don't fade quickly or rings that suddenly fit differently, is one of the more visible clues your body can give you if you know to look for it. Sign 4. Difficulty concentrating or a persistent mental fog. This sign tends to be the most surprising to people because it doesn't feel physical at all. It feels cognitive. Trouble focusing during a conversation, misplacing words that used to come easily, or feeling like your thinking has slowed down in a way that's hard to describe. It's easy to attribute this to normal aging, and to some degree, mild cognitive changes are a natural part of getting older. But there's a specific version of this fog connected to kidney function that's worth understanding. When the kidneys aren't filtering waste products efficiently, those products, along with shifts in electrolytes like sodium and potassium, begin circulating throughout the body, including the bloodstream that feeds the brain. This buildup can subtly affect concentration, memory, and mental clarity well before it causes any more obvious neurological symptoms. Research in kidney health has increasingly recognized this connection, sometimes referred to as the brain-kidney relationship, noting that even moderate reductions in kidney function can correlate with measurable changes in cognitive performance. This doesn't mean everyone with brain fog has a kidney problem. Sleep, thyroid function, medication side effects, and stress are all far more common culprits. But when this kind of mental fog appears alongside any of the other signs we've discussed today, fatigue, swelling, or changes in urination, it becomes a meaningful piece of a larger picture rather than an isolated complaint. This is particularly relevant for anyone managing diabetes or high blood pressure over many years, since both conditions place ongoing compounding stress on kidney function, and by extension, on the clarity of the mind those kidneys are helping to support. What should you do instead? Don't dismiss a genuine, sustained change in your mental clarity as simply getting older. If you've noticed this shift over the past several months, particularly alongside fatigue or swelling, mention all of it together to your doctor rather than each symptom separately. Physicians are often far better equipped to spot a pattern when they see the full picture rather than one complaint at a time. Sign 5. Muscle cramps and unexplained itching. Here's the sign that surprises even people in medicine because it shows up in two places you'd never think to connect: your muscles and your skin. Let's start with cramping. Many people experience occasional muscle cramps, especially at night, and most of the time this is entirely benign, related to things like mild dehydration or simply sitting too long during the day. But frequent recurring cramps, particularly in the calves and legs, can also signal an imbalance in electrolytes like calcium, phosphorus, and potassium, all of which the kidneys are responsible for regulating. When kidney function declines, this regulation becomes less precise, and muscles, which depend on stable electrolyte levels to contract and relax properly, can begin cramping more frequently and more intensely than before. The second half of this sign is persistent itching, medically referred to as pruritus. That doesn't correspond to any rash, dry skin condition, or new soap or detergent. This itching tends to be widespread rather than localized, and it often doesn't respond well to moisturizers or typical remedies. The connection here traces back to that same buildup of waste products and mineral imbalance we discussed earlier. As phosphorus levels rise and waste products accumulate in the bloodstream, they can trigger itching throughout the body, a symptom that's been documented in kidney health literature for decades, yet remains one of the least recognized outside of specialist care. Together, cramping and itching form a pairing that's easy to treat as two unrelated annoyances of getting older. In reality, when they appear together and persist over weeks rather than days, they can be one of the clearer signals the body sends about declining kidney function, precisely because most people, and even some clinicians outside of kidney specialty care, don't think to connect the two. The people most likely to experience this combination are those with more advanced, longer-standing reductions in kidney function, which is exactly why I want you to take this one seriously rather than waiting for it to resolve on its own. What should you do instead? If you're experiencing frequent muscle cramps alongside itching that has no clear skin-related cause, and especially if either has been going on for more than a few weeks, this combination is worth a direct conversation with your doctor about checking your kidney function and electrolyte levels. This is not a symptom pairing to self-treat with over-the-counter creams and simply hope improves. Let's bring all 5 of these together because on their own, each one seems minor. Together, they tell a much clearer story. The first sign was persistent, unexplained fatigue, often tied to reduced production of the hormone that tells your body to make red blood cells. The second was changes in urination, specifically persistent foam and increased nighttime bathroom trips, both reflecting how well the kidneys are filtering and concentrating fluid. The third was swelling in the ankles, feet, or hands, a visible sign of fluid the kidneys aren't clearing as efficiently as they should. The fourth was a persistent mental fog or difficulty concentrating, connected to how waste product buildup can subtly affect the brain. And the fifth was the combination of muscle cramps and unexplained itching, tied to shifts in the minerals your kidneys are responsible for balancing. None of these signs on their own guarantee a kidney problem. Each one has other, often more common explanations. But when several of them show up together or persist for weeks rather than days, they're worth bringing to your doctor as a connected pattern rather than 5 separate, unrelated complaints. So what can you actually do with this information starting today? First, ask your doctor about 2 simple, inexpensive tests at your next visit: a blood test for kidney function and a urine test for protein. These are standard, painless, and often already included in routine annual blood work, but it's worth confirming they're being checked rather than assuming. Second, keep your blood pressure and blood sugar within the ranges your doctor recommends. These 2 factors have more influence over long-term kidney health than almost anything else within your control, and managing them well is one of the most protective steps available to you. Third, stay consistently hydrated with water throughout the day rather than in large amounts all at once, and be mindful of regular use of over-the-counter pain relievers like ibuprofen or naproxen, since frequent high-dose use over long periods can place additional strain on kidney function. Fourth, keep a simple mental note, or even a written one, of any of the 5 signs we discussed today if you notice them. A single instance of fatigue or swelling isn't significant. A pattern that persists for weeks is exactly the kind of detail that helps your doctor make a faster, more accurate assessment. And finally, Don't wait for a yearly physical if something feels persistently different. Kidney function tests are quick, low cost, and can be ordered at almost any appointment. Catching a change early gives you and your doctor the most options for addressing it. Before you go, I want you to think of one person, maybe a parent, a spouse, an older sibling, or a close friend, who might be quietly experiencing one or two of these signs right now without ever connecting them to their kidneys. Sometimes the most valuable thing we can do for the people we care about isn't a grand gesture. It's simply sharing information that helps them ask the right question at their next appointment. I genuinely like to know which of these 5 signs surprised you the most. Was it the connection between fatigue and kidney function, or the pairing of cramps and itching? Let me know in the comments. I read through them, and it helps me know what to cover in more depth in future videos. And if you found this helpful, consider sharing it with that person you just thought of. This is the kind of information that matters most when it reaches someone before symptoms become harder to reverse. Medical disclaimer. This video is intended for educational purposes only and does not constitute personalized medical advice. It is not a substitute for a diagnosis, treatment plan, or consultation with a qualified healthcare professional. If you are experiencing any of the symptoms discussed today or have concerns about your kidney health, please speak with your doctor before making any changes to your medications, diet, or lifestyle. Everybody's health circumstances are different, and your physician is best positioned to guide decisions specific to you.